Hey everyone, welcome back to the deep dive. Today we're going kind of off the beaten path a bit, focusing on healthcare in Dadra and Nagar Haveli and Daman Diu.
Dadra and Nagar Haveli and Daman Diu.
Yeah, it's a mouthful. I know a union territory on the western coast of India. And just to give you a quick snapshot, we're dealing with a mix of tribal populations, industrial workers, rural communities, urban centers. It's kind of got it all.
A real mix of everything.
And the thing that really jumped out at me while prepping for this deep dive is the fact that healthcare here is managed directly by the central government, which is pretty rare in India, right?
Yeah, you don't see that very often.
So let's unpack this a little bit. What does it actually mean in practice for folks living there?
Well, basically it means the central government, through its Directorate of Medical and Health Services, is calling the shots when it comes to healthcare. They're responsible for everything from running the biggest hospital in the territory, Sri Vinoba Bhai Civil Hospital in Silvaso.
I saw that one on the map. It's pretty sizable.
Yeah, it's a big one, probably serving a pretty diverse patient population given its location.
Makes sense. And then you've got the whole network of different tiers of facilities too, right? Government hospitals and Daman and Diu, primary health centers, community health centers, sub-centers, and even mobile medical units.
Those mobile units are essential, especially with the diverse geography of the territory. Think about those remote areas and tribal regions. Getting healthcare to them is a whole other ballgame.
Definitely. And it's all free too, right? The government provides free healthcare services to all residents. Plus, they've implemented initiatives like Ayushman Bharat, PMJAY, and are working towards universal health coverage. So, in theory, access shouldn't be a problem.
Well, the intention is there for sure. These are big programs aimed at making healthcare affordable, but there's more to the story.
Okay, I'm intrigued. What's the catch?
Well, one of the biggest challenges the UT faces is a shortage of specialists.
Interesting.
Yeah, so think about it. If someone needs specialized care, they're most likely going to be referred to a hospital in Gujarat or Maharashtra.
So not only are people having to travel potentially long distances for treatment, but I imagine that also raises issues of affordability.
Exactly, and that's not even factoring in the potential delays in treatment. All of that puts a huge burden on patients, especially those who might already be dealing with challenging socioeconomic conditions.
Especially considering the significant industrial workforce in the UT too.
Absolutely. Their health care needs are unique and often overlooked.
And it makes you wonder why attracting specialists to the UT is such a struggle. Is it the infrastructure, lack of professional development opportunities? What's the deal?
It's likely a combination of factors. It's a complex issue for sure.
Yeah, it seems like a bit of a puzzle, especially with the government's commitment to free health care and those big initiatives you mentioned. You'd think that would attract talent.
Right, but it's not always that simple. There are other systemic issues at play that make it tough to retain specialists.
So what are we talking about here? What are some of the underlying challenges?
Well, one thing that jumped out from the source material was the high rates of malnutrition, tuberculosis, and maternal child health issues, particularly among the tribal and industrial populations.
That's concerning.
It is, and it paints a picture of a healthcare system that's struggling to keep up with the needs of its people.
And I imagine those specific health challenges require specific expertise, further highlighting the need for specialists.
Exactly. It's a bit of a chicken and egg situation.
It's a tough cycle to break, for sure. And the source material also mentioned the lack of advanced medical infrastructure within the UT. In fact, there's no advanced ICU.
That's a major issue.
It is. It means even for critical care, residents have to be transferred to hospitals in other states.
Which adds a whole other layer of complexity and stress during emergencies, never mind the cost and logistical hurdles.
It really makes you question the long-term sustainability of relying on external healthcare systems.
It's not ideal, that's for sure. And then you've got the issue of limited private healthcare investment.
Right. I was going to ask about that. Is that because of the affordability concerns we talked about earlier?
Yeah, in part, private healthcare providers might see the UT as a risky investment, given the low per capita income and the reliance on government-provided healthcare. So they're hesitant to set up shop, which further deepens the reliance on the already strained public healthcare system.
So we've got a shortage of specialists, inadequate infrastructure reliance on neighboring states, and limited private sector involvement. It seems like a pretty tangled web.
It is, and it's going to take some creative solutions to untangle it.
Well, on that note, maybe let's shift gears and talk about what some of those solutions could look like. What are your thoughts?
Well, the first thing we need to do is understand why specialists are hesitant to work in the UT in the first place. If we can pinpoint those deterrents, then we can start crafting solutions that address the root cause.
Makes sense.
Yeah.
So where do we start with that?
Well, maybe looking at what would make the UT a more attractive place to work for medical professionals, like building a supportive professional ecosystem, focusing on things beyond just salary.
Okay, what would that look like specifically?
Well, for one, investing in continuing medical education programs, create opportunities for research and collaboration, maybe even with institutions in those neighboring states, Gujarat and Maharashtra.
So not just throwing money at the problem, but actually making it a more stimulating and engaging place to work for specialists. Interesting.
Exactly. Give them reasons to stay and grow professionally. And then there's the issue of infrastructure we talked about.
Right, the lack of advanced medical equipment, like that missing ICU we talked about, building something like that from scratch seems like a huge undertaking. Is that even realistic?
It's a big project for sure, but
Yeah.
I don't think it's impossible. Maybe a phased approach would work. Start by upgrading existing facilities and gradually add those specialized units as resources become available.
So prioritize and make strategic investments as you go.
Exactly. And this is where those public-private partnerships could really come into play. Remember that idea from the source material?
Yeah, incentivizing private hospitals to set up specialized centers within the UT, right?
Right, like imagine a private cardiology center partnering with a government hospital to provide specialized cardiac care. It could significantly reduce the need for those referrals to other states.
That would be huge, especially for those patients facing long wait times for treatment.
Absolutely. Plus, it would take some pressure off those already overburdened government hospitals, allowing them to focus on primary and secondary care.
So it's about creating that synergy between the public and private sectors, everyone working together.
Exactly, using each other's strengths to build a more comprehensive healthcare system for the UT.
And speaking of strengths, what about the potential for telemedicine, especially for those remote tribal communities?
Oh, absolutely. Telemedicine could be a game changer. Imagine a specialist in Mumbai consulting with a patient in a remote village in Dadra Nagar Haveli. No travel time, reduced costs, improve access to timely care. It's a win-win.
It seems like a perfect solution for a region with such geographical challenges.
It could be. But we need to be realistic about the implementation, too. It's not just about the technology itself. You need to invest in training healthcare workers on the ground, make sure there's reliable internet connectivity in those remote areas.
So it's about integrating the technology thoughtfully, not just dropping it in and hoping for the best.
Exactly. And, combining these strategic infrastructure investments with innovative solutions like telemedicine, it's a multi-pronged approach that could really make a difference.
I like it. It's about addressing multiple challenges, simultaneously creating a ripple effect of positive change.
And it's not just about addressing the immediate needs. It's about empowering the UT to take control of its healthcare future, build something sustainable.
Which brings us to that big idea from the source material establishing medical colleges and nursing schools within the UT itself.
Right. That's a big one.
It seems almost too ambitious. But if it works, we're talking about creating a whole pipeline of healthcare professionals, specifically trained to meet the unique needs of the UT.
Exactly. People who understand the local context are invested in the community, more likely to stay and practice there long term.
It's about building that self-sustaining healthcare ecosystem we talked about.
Right. And it's not just about doctors and nurses either. We need to think about training all those allied health professionals too, lab technicians, pharmacists, community health workers. They're all essential.
So it's really about shifting from dependence to self-reliance,
Yeah,
taking ownership of your healthcare destiny.
exactly. And I think there are some great examples out there of other regions that have successfully implemented similar approaches, places we can learn from.
Well, that's encouraging. Are there any that stand out in your mind?
Well, Tamil Nadu, for example, they've had a lot of success with a decentralized model, establishing medical colleges in various districts rather than concentrating them all in big cities.
So spreading the resources and expertise more evenly across the region.
Exactly. And that could be a really relevant model for Dadra and Nagar Haveli and Daman Diu, given its own geographical spread.
That's a really interesting comparison. Adapting successful models rather than starting from scratch seems much more practical.
And there are a lot of valuable lessons to be learned from these success stories. What worked, what didn't.
So what are some of the key takeaways? What's the secret sauce?
Well, one thing that comes up time and time again is collaboration. Those successful medical institutions often have strong partnerships with established hospitals and research centers. They provide students with that hands-on experience and mentorship.
So it's not just about the classroom, it's about creating those real-world learning opportunities.
Exactly. And the UT could really leverage its proximity to those neighboring states create partnerships with their institutions.
So tap into that existing network and expertise, build those bridges.
Exactly. It's all about building that support system both within the UT and outside of it.
I love that approach. It's so much more holistic than just focusing on bricks and mortar.
It is. And it's been fascinating diving into this healthcare system with you today.
I agree. We've covered a lot of ground, from the challenges of a centrally managed system to the potential of those public-private partnerships and that long-term vision of establishing those medical colleges.
Yeah, it's been a real deep dive.
And what strikes me is that Dadra Nagar Haveli and Daman Diu isn't unique in facing these challenges. A lot of regions across India and even globally are dealing with similar issues, shortages of healthcare professionals, inadequate infrastructure, unequal access. It's a widespread problem.
It is. It's a reminder that healthcare is this incredibly complex, interconnected system, and finding solutions requires a multifaceted approach.
But it's not all doom and gloom, right? There's a lot of innovation happening, too.
Yeah.
New models of care are emerging. People are experimenting and finding ways to improve things.
Absolutely. And I think that's what makes these deep dives so important. It's not just about highlighting the problems. It's about exploring those potential solutions, understanding that healthcare is constantly evolving. What seems impossible today might have a solution tomorrow.
It's about staying curious and hopeful.
Exactly. And never giving up on the pursuit of better healthcare for everyone. It is. And it's about more than just those big flashy initiatives. It's about creating a system that really empowers the UT to take ownership of its healthcare future.
It's about long-term sustainability, not just quick fixes.
Exactly. And you know what? We've talked about a lot of challenges, but it's important to remember that Dadra and Nagar Haveli and Daman Diu isn't alone in this alone. A lot of regions across India and even globally are grappling with similar healthcare issues. Shortages of medical professionals, limited infrastructure disparities in access. It's a widespread problem.
It's a reminder that healthcare is this complex, interconnected system, no matter where you are.
And finding solutions requires that multi-pronged approach we talked about. It's not a one-size-fits-all situation.
Definitely. But amid all these challenges, there's also a lot of innovation happening, right? New models of care are emerging. People are experimenting and finding ways to improve things.
Absolutely. And that's what makes these deep dives so compelling. It's not just about highlighting the problems, but exploring those potential solutions, understanding that healthcare is constantly evolving. What seems impossible today might have a solution tomorrow.
It's about staying curious and hopeful.
Exactly. Never giving up on the pursuit of better healthcare for everyone.
Well said. And on that note, I think it's time to wrap up this deep dive into the healthcare system in Dadra Nagar Haveli and Daman Diu.
It's been a journey.
It has. We've explored the unique challenges of this centrally managed system, the potential of those public-private partnerships, the long-term vision of establishing medical colleges. It's been a fascinating exploration.
A real deep dive.
And what really struck me is that the situation in Dadra and Nagar Haveli and Daman Diu isn't unique. So many regions around the world are facing similar struggles.
Yeah.
It's a reminder that healthcare is a global issue, a human issue.
It is, and ultimately it's about people's lives and well-being.
Exactly, and that's something we should all keep in mind, whether we're policymakers, healthcare providers, or just everyday citizens. We all have a role to play in shaping the future of healthcare.
Couldn't agree more. The more we understand these complexities, the better equipped we are to advocate for positive change.
Absolutely. So to our listeners out there, keep exploring, stay informed, and engage in those conversations about how we can collectively build a healthier future for all.
Because healthcare is a shared responsibility.
Thanks for joining us on The Deep Dive. Until next time, stay curious.